looking for the entire county, serving Dillon, Latta, and Lakeview by covering our local news and upcoming events. Please join us now for Chamber Moments.
Hello, welcome to Chamber Moments. I'm Johnny Lors. Today I have as my guest Mr. Herbert Jacobs, and Mr. Jacobs is here with the census. He's a volunteer, and we need to talk a little bit about Dillon County with the census. Welcome, Mr. Jacobs.
Well, thank you very much, Ms. Lewis. Dillon County right now is not doing as well as we'd hoped to do. And I'll get this out of the way. Obviously, coronavirus and the pandemic has had an impact on our numbers thus far. Fortunately for us, as well as for all the other counties throughout the country, the Census Bureau has made some adjustments. They've extended the period of time for which the data can be collected, and we are now 29 days from the last day of that extension. September 31st is the last day that information can be collected. And basically, any information, for example, the mail-ins, if those are postmarked the 30th of September, and they are received by the Census Bureau on or before the 7th of October, then those ballots or those surveys will count. Unfortunately, if they're postmarked after the 30th of September, they will not be included. And even if they're postmarked 30th of September, but they're received on the 8th of October, those would not be included in the total count.
Okay, Mr. Herbert, you had told me earlier when we were talking, where does Dillon County rank in the state of South Carolina in the counties?
There are 46 counties, and Dillon County ranks number 44.
Okay.
And we've been there consistently.
Mm-hmm. And we know that has to do with a lot of things. You were talking about the virus, but it's also that folks that have a P.O. box, they do not receive any information about the census. Is that correct?
That is correct. And one of the areas that's been most impacted by what you just stated is the Lakeview area. Mm-hmm. Those individuals in Lakeview, and I understand that maybe disproportionately, residents in Lakeview do have post office box numbers. As a consequence, they did not receive anything in the mail.
Mm-hmm. Now, I know that you have been working with different organizations trying to rectify this. Let's talk about some things that are going on that can help us with this.
Okay. I can share with you some things that have happened already and will continue to happen throughout the month of September.
Okay.
The partnerships that we've had, kind of a ragtag, so to speak, group that kind of came together and decided this was something that was worth our combined efforts. Mm-hmm. We have utilized some of the networks that existing organizations have, and they have used their network to actually pass out information. For example, the Dillon County Collaborative Council has quite a few individuals that comprise that group, and these are individuals representing agencies such as Trinity Behavior Care, for example. But the lady who coordinates that organization has been very helpful in that she's made available by way of email information to these various agencies. These various agencies have in turn been able to share this information with their clients.
And even though we're able to share this information with the clients and with the residents of Dillon County, we still are very, very slow in turning in our numbers. Let's talk a little bit about our census workers now going to the homes.
Yes. Beginning on the 9th of August last month, census workers in the field started working the Dillon County area. Now, these individuals are pretty clearly identifiable. When they come to your homes, they will have U.S. Census Bureau issued ID badges, which they'll generally carry on a little, I don't know what you call that thing, but they hang it on their neck and carry that with them. They'll have a little attaché case that has clearly marked on it U.S. Census Bureau or 2020 Census, something akin to that. And they're just your neighbors, if you will, who are out trying to get the numbers up in Dillon County.
Okay. Have you hit any events coming up where people that are not comfortable with answering the door? Because, you know, some people live alone and they might not be comfortable with answering the door if somebody is a stranger that they do not know comes and knocks. Is there any events coming up through this month, through September, to try to encourage folks to come out and fill out the census form?
Yes, we've got a combination of at least 2 categories of events that are coming up. For example, Congressman Tim Rice was sponsoring a back-to-school event on tomorrow at 11 o'clock at Dillon High School. He allowed us to partner such that we can be there making available flyers as reminders of individuals to please participate in filling out the census survey if you have not done so. In addition to that, we have planned an event for the 19th of September, which will take place at the Lakeview community. And at that event, we're looking to have individuals available who will be there to not only encourage individuals to fill out the census survey, but there will be a designated booth or multiple booths where individuals who have not completed the survey can go to that booth, and you're in essence doing your census survey online right there.
Okay. And that should take less than 5 or 10 minutes, I believe.
10 minutes at the most. I know I did mine online, and I did it in less than 3 minutes. It took me longer to read the material that was mailed to me than it did for me to go online and complete the census.
And when you're doing the census form, there's not very sensitive information, so that you don't have to give out your Social Security number or anything like that.
That is absolutely correct. Probably the most intrusive or invasive information you give would be maybe your telephone number. And for those of us who don't readily like to tell our age, that's one of the questions that's going to be asked. And related to asking your age, they're going to be asked what is their birthday. Okay. Beyond that, let's say for the primary person in the house, there are basically 9 questions that are asked. Age, birth date, do you rent this house? Do you own this house? Are you buying this house? They'll ask for that person's telephone number. Then they want to ask the person's gender. They will ask the person's race. And they'll ask the person's ethnicity. And that's pretty much it. And for anybody else, there are only 7 questions that have to be answered.
Okay. So let's remind everybody that they have until when in September to complete it?
Any information that, whether it's online, by telephone, or by mail, if it's postmarked the 30th of September and received on or before the 7th of October, it counts.
Okay.
So the 30th of September is the deadline.
Okay.
I would encourage folks to not wait until the 30th of September. Today is the 1st, so you can go online, and the website is www.my2020census.gov, or you can go or use your telephone. The number there is 1-844-330-2020. And then obviously, if you have the form that was mailed to you, just fill it out, 10 minutes maybe, less than that. Put it back into the postage paid envelope, drop it in the mail so the U.S. Postal Services can postmark it and get it gone.
Okay. Thank you so much.
Well, you're welcome.
I'm Johnny Lures with Chamber Moments. Hello, welcome to Chamber Moments. I'm Johnny Lures. Today I have as my guest Pat Laird, and Pat does a lot of different things in Dillon County. She has been named the Dillon County Volunteer of the Year and Citizen of the Year. And but that hasn't stopped her. She's kept going, and she's going to continue working with some different programs we have, and one is the Dillon County Healthy Initiative.
Right.
So they're responsible a little bit for the farmers market and what's going on with that. So talk about the farmers market.
Okay, we have 2 more farmers markets in this farmers market season, September and October. And the one in September will be the 14th from 4 to 7 on the South Plaza here across from the train station. And I've had a couple more people who have, that will have new vendors that have been contacting me. So I'm really excited about that. We're in great hopes that Katie Price will be able to come back this time too with her beef.
Well, I noticed last month you had farm fresh eggs. And
We
those
did.
were wonderful.
Yes, we had a couple new vendors last time too. So I'm real excited that people are contacting us about being vendors for the farmers market, and there's no cost.
Right.
So.
Okay. Now, if somebody is like a nonprofit and they want to promote their business, are they able to come and set up a table?
Yes, they are.
Okay.
They are. We've had Mr. Herb Jacobs with the Census come, and Lions Club selling brooms, and so anything like that is fine.
Okay, very good. Well, let's talk a little bit about an event that's scheduled in Lakeview, I think on September the 19th.
September the 19th, Saturday, September the 19th from 10 to 1. We're going to be at the parking lot next to the community center. Now, if it's raining, we'll be inside the community center. But we, as many people know, that Dillon County is 44th out of 46 counties in their census, and Lakeview is like at 38 or 39% of their population. And so we're going to have a big event and hope everybody will come on out. If they haven't filled out their census form, fill out the census form. We're going to have a lot of things going on. We're going to be giving away Learning Loot, which is another DCHI and Raleigh. And there'll be bags of school supplies. So we're going to be giving those out. I'm going to try to get that Hartsville Bubble Guy to come too, so everybody enjoys Dave and his bubbles. So we're going to just have a lot going on that day, and hope everybody will come out. And you don't have to be from Lakeview. If you want to come on down, just come on down. That's fine.
The hours?
10 to 1.
10 to 1.
10 to 1.
And do we have to bring anything or anything like that?
No.
Okay.
No.
All right.
And if you haven't filled out your census form and you would like to fill it out, we will have people there with iPads to help you fill out your form. And it takes less than 5 minutes. And I know people are worried about what kind of questions are asked and but it really isn't. And we lose out every year in Dillon County with so much federal money that we could get because our census numbers are so low.
And the money is used for bridges and roads and education,
schools,
hospitals.
yes,
and everything.
just all your infrastructure needs, can be addressed with this money, and keep from raising taxes.
Right, and we need to have the people fill them out, and like you say, Lakeview, you don't have to be just from Lakeview, all throughout our county, just come on and fill it out.
Come on, fill it out. We'll be
Okay.
glad to help you.
Well, let's give our viewers the dates for the Farmers Market
Farmers
again.
Market is September the 14th from 4 to 7 downtown in the South Plaza. And the event in Lakeview is September the 19th, that's a Saturday, from 10 to 1.
Okay, thank you, Pat.
Thank you.
I'm Johnny Lures with Chamber Moments. Hello, welcome to Chamber Moments. I'm Johnny Lures. Today I have as my guest Donna Sellers. And Donna is with Dillon Family Medicine, and they, I think in partnership with First Baptist Church, have started a new program there. Let's talk a little bit about that.
Sure. What we're doing is we're going to have the first fixed COVID clinic for drive-through testing in Dillon County. So you'll know where we are each day. We're going to be there Monday through Saturday. The hours can be found on the DillonFamilyMedicine.com website, but we can list those a little bit later.
Okay. Well, let's talk about when you say a fixed site. Tell me about that a little bit.
We're going to be partnering, as you said, with First Baptist Church, so we're going to be in their parking lot. So each day you'll know where to find us. We're going to be at 400 North 4th Avenue in that clinic from noon to 7, Monday, Tuesday, Thursday, Friday. We'll close early on on Wednesdays because we want to, honor the evening service.
Right, and you want to be able to, like you say, honor the evening service for folks. And
Right, and then on Saturday from 8 to 1.
Okay. Let's talk a little bit about what you're going to be doing.
Sure. So what we're offering is completely drive-through service for your COVID testing needs, which means you will never get out of your car. I'm telling folks, think that nice chicken sandwich line, but at the end you're not going to have a sandwich. You're actually going to have a swab for the COVID. But there'll be different stops along the way. We do ask for everyone to be patient. There may be a line from time to time. If you want to do your telehealth visit online, you can go and schedule a time, have that accomplished before you arrive. If you don't have the means to do that, we'll have a way on site. We'll have someone to assist you to navigate that process. The point of the required telehealth visit is so that Dillon Family's establishing a relationship with you, so if you need that work note, plus it gives us an access to know why you want to be tested. If you've had an exposure, make sure that you're tested in the correct time frame, not too early, so you don't get a false negative.
Let's talk a little bit about the time frame.
Okay. What we say is, one, if it's just a curiosity, you want to know if you have the infection, because roughly 40%, 2 in 5 people, have the odds of having asymptomatic infection. So they're walking around and they're exposing folks unbeknownst to themselves. So those folks, which would be you or I or anybody, has had the chance to be exposed. But if you have a known exposure, and by a close contact, it would be someone that has either symptoms or the infection, 15 minutes or more, less than 6 feet apart, with no mask. And so if you know that you had that exposure yesterday, you don't need to be tested today. Your body has not built up the antibodies if you're infected to be detected. So actually we're looking at day 5 after a known exposure, just because the research has shown that's the day where there's the least chance of a false negative.
Okay. Who should be tested? Do we have an age range in there?
It is actually anyone. I mean, it's one of the few things, there's no contraindications for the test. First, if you're symptomatic, you have cough, fever, chills, body aches, GI symptoms, diarrhea, vomiting, anything concerning, we want you to be tested with symptoms. If you do not have symptoms, like I said, 40% of the cases are, estimated to be asymptomatic. And what is 40%? That's if you have 5 people in a room, 2 of them are likely to have the chance of being an asymptomatic carrier.
Is there a cost involved with this?
Most insurances are covering the cost of both the telehealth and the test. Should your insurance not cover the cost, the CARES Act does, or if you're uninsured, we will submit to the CARES Act for coverage, so there's no out-of-pocket cost for the molecular test, which is the one we're doing, the nasal swab. And the molecular test is the RNA test, and it takes 2 to 4 days to get those results back, and it shows active infection. So if you get a positive molecular test, you have the coronavirus.
Okay, and if you receive a positive test, what happens then?
Someone will be in touch with you via phone to let you know that you do have a positive test, and according to law, we will report to DHEC, and then they will be, following up with maybe a contact investigation. That's on their side. But you'll have that phone call to let you know how to manage your symptoms, what to look for, when to, look for further medical care, anything life-threatening like chest pain, bluish lips, anything that would indicate a medical emergency. And of course, because of that telehealth visit, we can give you an extended excuse for work or school.
Okay. I know we're getting close to flu season, and some of the symptoms are very similar.
It's going to be a challenging time teasing it out. So, of course, we would recommend, I personally would say, if you're having those symptoms and you're concerned about corona, come through the drive-through. Get your test. We're saying that 2 to 5 days. We're hoping to get it a lot shorter, but we'd rather guarantee on the long end and over-deliver. Once that's negative, then we would move forward. Getting in with your provider for the flu and strep screenings, those sort of things.
Now, Donna, this show is seen both in Dillon and Marion counties and some up in North Carolina. If somebody's from Marion County, are they able to come in,
Absolutely.
or North Carolina?
We're not limiting it to any borders. If you are from New Jersey, driving down 95 and stop at McDonald's and see what's going on, come on. As long as you have your insurance information to provide or a social security number, because that's what we'll use to submit the claim with the CARES Act. It's open to anyone.
What about a photo ID? Most people need that.
Right. What we ask for you to do is a state issued ID. and then your insurance card are the two things we need you to bring. And what you'll actually do is you'll hold that up to your vehicle window. There won't be a passing back and forth. You'll actually hold it up, and there'll be somewhere to take down that information for both cards. So we're even limiting the exchange of potential pathogens through the window.
Now, if my car has 4 people in it and 4 people want to be tested, can all 4 be tested at the same
Absolutely.
time? Or I don't have to go back through the line or anything?
No, what we'll do, whoever, we want you beside a window. We don't want somebody reaching over. But I would say as long as it's somebody situated beside a window, that we can test, absolutely. There's no...
What's the youngest age that you feel
There's
comfortable?
no limit on the age. So now it is a nasal swab, so you'd have to think about can the child sit still for 10 to 15 seconds with the swab.
Right.
Because what we'll actually ask you to do is if you're in the driver's seat, hold the steering wheel after the car's in park. And if you were a passenger in the car, that's my biggest, we don't want anybody. But if you're a passenger, even like maybe kind of sit. When I had mine done, it was a face-to-face type situation, and I was advised to sit on my hands, put my hands under my thighs so that, because the tendency if it's uncomfortable, you want to touch, and we don't want that. Because it's a nasal swab, but it's not unbearable by any means. It is, it's...
All right, and we don't have to do anything beforehand,
absolutely not.
no prep for it whatsoever.
No prep whatsoever. You can get up on Thursday morning to say, I need to go be tested for COVID, hop online, maybe do your telehealth visit before you get there to streamline the process, come in, be tested, and hopefully in and out in a short amount of time.
Let's tell our viewers again the telehealth, what they need to do.
What they would need to do is we'll actually have a website, www.covid19dillon.com. And if you can't remember that, Dillon Family Medicine will also have a link on that page where you'll go, and it'll be a simple website, individual testing. You'll click there, and it'll say schedule a visit. Click there to schedule the visit. You'll choose a time, and once you've booked your time, you'll actually get an email to your email address, and it will be a link that you just click on when the time for your visit comes, and the visit proceeds.
Okay, but if I don't make a time and I just am driving through and thought about it, we can still just come on up and just know that I will have to wait or just...
Right, like my parents, they live out in the rural part even of Dillon and don't have a smartphone. So telehealth would not be an option for them at home because they don't have the broadband, that sort of thing. So they could actually do it on site. We'll have someone on site in a little sub-parking lot to help navigate that telehealth visit before you get in line.
Okay.
And if you're going to do it there, I would say allow maybe an extra 30 minutes.
Okay. Let's tell our viewers again when this should start.
Okay. We're planning to start Thursday, September 3rd, and it'll be from noon to 7. Every day except Wednesday, which will be noon to 4, and Saturday will be 8 to 1.
Okay. Thank you, Dawn.
Thank you.
I'm Johnny Lures with Chamber Moments. Hello, welcome to Chamber Moments. I'm Johnny Lures. Today I have as my guest Don Lures, and Don is here with hospice, but there's some information about hospice. Hospice Care of South Carolina, but is it Hospice Care of South Carolina?
A new version, yes.
A new version. Tell us about it.
Yeah, Hospice Care of South Carolina. I've been with the company for this Christmas will be 9 years, so it's been a good long while. And most of the folks I work with have also been there as long. Some of the folks that were there when I first started are still in the Dillon office. So we're still the same team, but we are starting to have a new name. The way that came about is back in January, Hospice Care of South Carolina acquired Agape Hospice. Up until that time, Agape Hospice has been another hospice operating in South Carolina and actually about the same size as our company. But we acquired them in January, and we've been working side by side since January, and over the past few months have started the operation of taking two companies and making one company out of the two. So now we're coming to the end stretch of that, and part of that is renaming, rebranding both companies to operate truly as one. So they took Hospice Care of South Carolina, and they took Agape Hospice, and from here on out will be known as Agape Care South Carolina. So they took a little sliver of this one, a little sliver of that one, and made a new one. So Agape Care South Carolina will be our new name. Same local team, same exact organization, just bigger with more resources, so I think it's a positive thing.
Let's talk about some of the extra resources that you will have, that you'll be able to offer.
Well, first of all, we just have a bigger team with more clinical staff on board. So
Still
that's-
local?
Still
local
local.
people.
In fact, the Dillon office itself that serves Dillon and Marlboro County is exactly the same. The Florence office will be handling Marion County with the same team they had locally in Florence. So the actual nurses are going to be exactly the same. There will be some new nurses, especially in the Florence office, because there are more formerly Agape nurses coming into the fold in the Florence office than there is in the Dillon office. But bottom line is, if there's not going to be any subtraction, there's going to be addition in some offices, and the staffing will be the same folks that people have known over the years. I know a lot of folks like us because they've got to know us over the years. And the aides and the nurses and the social worker and the chaplain that are in the homes are the ones people know, because
Right.
they got to meet them during a family need. Those folks are all with us still and continuing, and that's not changing. The name is changing. Probably the biggest new resource is we have never had inpatient hospice house facilities anywhere in the state. Agape did, so now as we're combining as one, we will have hospice houses scattered across the state. We still don't have one locally, like right in the PD, but we do have one in Somerville, we have two in Columbia, and we have one in the upstate.
Okay.
So that's probably the biggest addition. And by having those, it does give me hope that maybe down the road, the opportunity will have a more local version of that.
Now, how would they reach you? Is it still the same way? The numbers changing or anything?
No, the numbers are still the same. If they happen to have a Hospice Care of South Carolina pin, that 1-800 number on the pin or the 1-800 number on any literature is still the toll-free number for Hospice Care of South Carolina, now Agape Care. My cell number is still the same, 843-506-2067. And for doctors and other referral sources out there, even our fax number is still the same. So how to reach us is just as easy. You just don't get thrown off if they say Agape Care when the phone when they answer the phone.
Exactly. Okay. Is there anything else you want to tell our viewers?
Just a thank you for allowing us to help them as often as they have over the years. Like I said, I've been here 9 years now, and it's always a real rewarding feeling to know that you have someone struggling out there, either a patient or a caregiver or a family, and they allow us to step in and make that struggle a little less of a struggle. So thank you for that.
Okay. I'm Johnny Lures with Chamber Moments.